Thank you very much. We have a really important assignment, and the goal of this meeting really, how to grow the movement to win single-payer national health care. I'm optimistic. Some friends and not friends say I'm too much optimistic, but I think in this situation we can be optimistic. And I want to quickly outline in the miserable amount of time we've been allotted where I think the pressure has to come. And number one on my list continues to be the insurance companies, the for-profit insurance companies, which is the heart of the matter. We start this campaign with great advantage. The American people, almost to the last person, recognizes what a obscene, greedy, destructive, Congress-controlling enemy of the people. And I would argue that whatever else we do, we trade on that reality and enhance the public's outrage at such a big distortion of the democratic society. Beyond that, we should recognize that the bill, the 1,900-page bill, if you have the stomach to go through it, it has alienated very important, vital, popular sectors. For example, it continues the obscenity, the word again, obscene, of excluding undocumented aliens. 11 million people, fellow people in our society who do so many important things, have traded on the xenophobic mindlessness promulgated by the right wing and making an object of contempt people that we should welcome. And it's against every religious, moral, politically moral item that we have allowed that to stay in the bill. I'll say self-critically that in the Wiener Amendment, of blessed memory, we have to sort that out, but Congressman Wiener put an exclusion on, in an effort to get more votes, he said, an exclusion on undocumented workers. We have to reach out to those people. They're an important part of our society and make them part of the coalition. The other groups we've graced with as leader, perhaps the most significant feminist organization in the country now, which knows full well that we were set back to pre-Roe v. Wade by the kind of stupid and stupidities that were intruded on the bill. I shan't enumerate the sectors, but I take the liberty of telling you about these. This is a winning coalition, and these people know from their everyday experience the depravity and the abuse of this health system, which was testified just in the introductions here. We have to make sure that awareness of the idiocy and the nonconformity, it can't be said often enough that every other single democratic, advanced industrial society in the world has seen fit to adopt a single-payer variant, and as a result they have much better health status, much lower costs, and their economies can breathe. We are on a death trip with our exorbitant 1/6 of the economy now in the hands of these predators. Every year it goes up, and it will go up in the bill they just passed. God knows what it will be at the end. So in sum, I'm suggesting we have a winning coalition. We have to keep our hand on the plow. Healthcare now is obviously important, very important sector, but we have to grow its strength manifold because it's not there yet. But I believe the American people are ready, and I believe this what we want to call rendezvous with evil that they've just gone through, and it'll be worse after it goes to the Senate, that they'll be ready for something better.